How you doing, everyone? Today we're going to be talking about carpal tunnel syndrome. So first off, what is carpal tunnel syndrome? Most people are correct in assuming carpal tunnel syndrome comes from the wrist. Now, what it doesn't include usually is going to be generalized wrist pain, wrist sprains, wrist overuse injuries that occur through here, which, interestingly enough, are where the carpal bones exist. So carpal bones are these little 8 bones that are at the wrist joint, and they surround a nerve that courses basically from the neck all the way down through the wrist, through this carpal tunnel that these bones form. Now, the symptoms of carpal tunnel are pretty straightforward. They might include a little bit of wrist pain, but typically they involve numbness and tingling of the thumb, the pointer finger, and a portion of the middle finger. So if you're just having wrist pain and maybe having pain down in these last 2 fingers, it's probably something else going on. So again, back to carpal tunnel, numbness, tingling, a little bit of weakness in this, and this finger. We're on the right page right now. So the question is, what are you going to do about it at home? First and foremost, some simple things you can do at home are going to be stretches. The nerve, the median nerve running through this region is overrun by a number of tendons in that area. These tendons are the ones that are going to be closing your wrist. So typically if we spend a good portion of time on the keyboard typing, these tendons and these tendons are going to get overused. So simple wrist stretches can be very effective. Now what do you do for the wrist stretch? I'm going to use my right hand since I can get closer to the screen. First wrist stretch, we're going to be kind of holding the hand out here, and then we're just going to be stretching the hand backwards. We can all see that one. Now we're going to hold this stretch for about 15 to 30 seconds. We're going to repeat this 3, 4, 5 times a day, as much as you'd like. Especially if we're on the keyboard a lot, we're going to take lots of breaks and we're going to kind of run through and stretch it this way, and we're going to add 1 or 2 more stretches. So here's another stretch we're going to do. It's going to take that wrist down, and we're going to push it downwards. And again, here we are, wrist is down, and we're going to push that wrist downward. Careful not to hurt the wrist joint. So we should feel maybe a little discomfort here, but most of it we want to feel this little pull onto the top of our forearm. So the wrist down, about 15 to 30 seconds, 3, 4, 5 times a day, or more if you're on the keyboard a lot. And hands going out this way. Now, on the subject of keyboards, carpal tunnel is very prominent in people that spend a lot of keyboards or on their cell phones. So another good thing you could do at home is stop using these hand-heavy instruments, holding iPads, working your text, playing on the keyboards. More breaks will be good. Now, another stretch that's often overlooked is what we call a lumbrical stretch. And the lumbrical is going to be these little muscles that are inside the hand. So one lumbrical stretch we're going to do is we're going to simply make what I call the bear claw. And then we're going to take our hand and we're just going to pull the knuckles back and down as we stretch out the lumbricals. So far we've shown you 3 stretches that you can do at home, and our stretch patterns are going to be the same across the board. 15 to 30 seconds, 3, 4, 5 times a day, or more if you'd like. All right, so now we've covered one good thing you can do at home, and that's going to be our stretches. The other good thing is we're going to take more breaks on the keyboard or on our text, holding up our iPad, or every hand-dominant activity. So some of you bodybuilders out there using free weights, you might get a little bit of response if you maybe drop to bands or you use some exercises that are less hand-dominant. Now, another thing we can do is a simple wrist brace. So this is the product I use in the office, but in essence, what you want is a brace that's going to strap around the wrist, especially at night. So night splinting is going to be one of the highest recommendations we can give for carpal tunnel. So we put that night brace on, and the reason we do that is so the wrist at night doesn't flex or extend. You know, your head's in all sorts of weird positions. Wearing that night brace is highly recommended. You can get a good night brace for $15, $20, or you can spend as upwards of $200 for them. I don't know if there's any real difference in the cheap ones or the expensive ones, so put on a good night brace, see how it works. Questions my patients often have is, should I just use a night brace or a day brace? And the research isn't very clear on whether a night brace is better or a day brace. I tend to find my patients do better with the night braces because they don't interfere with their activities. So for instance, if you want to spend a lot of time on the computer, you're a construction worker, you're a chef, or you work in the kitchen, you can't wear the brace in the day. So I think the information on its effectiveness is a little skewed because people aren't as compliant wearing it throughout the day. But the more you wear it within reason, the better off and the better rested your wrist will be. So night for sure, and if you can get away with wearing it a good portion of the day, I would recommend that. Now, other things we can do for the wrist at home is going to be a little bit more off the pattern, but what we have here is a simple TENS garment. So it's a little glove. It's a little glove you can buy for about $20, $30, $40, $50, and it's attached to an electric stim device. So many of you at home have the little TENS units, a little portable EMS unit. Quality of the units vary, and again, you could spend $50 or you could spend $500 on a unit. They're all effective enough, and we just simply plug it in, and we let these electric stim units help soothe our hands. Now, I'll say this, the TENS units and the garments are really not good in the long term to help the hands, but oftentimes they'll give relief when those hands are throbbing or numb or just outright painful from a day's activities. Now, speaking of other things that are good for palliative measures, meaning what's going to make them feel better. Paraffin therapy, wax therapy is known to be pretty good. It's a form of deep heating. So for those of you who get the mani and the pedi, when they dip the hands in the wax therapy, that's known to be effective as well. But other things could be effective. Hot packs at the house on the hands might also be effective. Now, probably one of the better things to do for carpal tunnel would be a series of different exercises. The exercise is going to be more specific to the need, so that's something you might want to talk to an orthopedist, a sports chiropractor, a physical therapist, or a trainer about to strengthen these wrist extensors and these elbow extensors. In a later video, we'll talk about some specific cases where we might have exercises for your home needs. But for the time being, let's remember what we talked about today. Certain stretches that we can provide, including our lumbrical stretch, maybe taking more breaks, maybe wearing a wrist brace, maybe getting a TENS unit with a garment. Again, this is Dr. Ray from Bradford Family Chiropractic talking about what you can do at home for carpal tunnel.